I'm Greg DiRienzo, and I'm the CEO and founder of Integrative Cancer Centers of America. And yes, we practice integrative and alternative and complementary medicines, but we also give short course radiation purposely. Why? Because short course radiation does two things. Number one, it reduces the overall tumor mass in a very compressed amount of time, particularly when you add what's called a chemosensitizing agent. But equally important, if perhaps not more important, is it greatly hinders the potential for future cancer recurrence. Remember, it's not necessarily the primary cancer that will take the patient's life. Typically, it's the metastatic or the recurrent cancer. So short course radiation does two things. It greatly reduces overall tumor mass very quickly, and it puts up a great defense to hinder the future potential for cancer recurrence. In the US, typically, a patient undergoes 30 to 35 fractions or sessions, if you will, of radiation. It's a huge amount of radiation that is measured by what we call grays. At our clinic, we use at most 10 fractions. So we are using a third of the amount of radiation that is used by our contemporaries in the United States, clearly eliminating what we term collateral damage. How many times have you been at a party or dinner or at a social event where someone tells you about the draconian results of massive amounts of radiation, the breast treatment or prostate treatment? None of that occurs with short course radiation, yet you're getting all the benefits of radiation, but none of the detriments. Hugely important difference between what we do at our cancer center and what's done by conventional practices and standards of care in the United States. So if our tumor board says that you're a candidate for short course radiation, listen, have an open mind, recognize that our clinic's ethos is do minimal to the patient in pain and suffering, but maximize the overall efficacy and results of treatment.